Well, a year ago, on the very first day of his second term, US President Donald Trump signed an executive order to withdraw the United States from the World Health Organization. Now, after completing the mandatory one-year notice period, the US is officially out of the WHO. When signing the order last year, Trump described it as a big one, and indeed, it was. Hello and welcome. You're watching NewsX Deep Dive with me, Vineet Malhotra, and today we take an in-depth look at why the US decided to exit the world's leading health body and what this means for global health. Let's start with the reasons cited by Donald Trump for this unprecedented move. According to him, the WHO had, in his words, ripped off the United States. The main point of contention, however, centered on China. Trump argued that while the US contributed far more to the WHO, China, the world's most populous country, paid significantly less. Listen to what Trump said in January 2025.
Withdrawing from the World Health Organization, sir?
Ooh, that's a big one. So we paid $500 million to World Health when I was here, and I terminated it. China, with 1.4 billion people, we have 350 to pay. We have, nobody knows what we have because so many people came in illegally, but let's say we have 325. They had 1.4 billion. They were paying 39 million, we were paying 500 million. It seemed a little unfair to me. So that wasn't the reason, but I dropped out.
To understand this claim, let's look at the numbers. According to the WHO data for 2022-2023 period, the top 10 contributors to the organization are displayed on your screen. The United States contributed a staggering $1.2 billion, while China did not even make the top 10, contributing just $157 million. That is roughly 80% less than the US. Breaking down the US contribution further of the $1 billion and the $218 million went as assessed contributions, $1 billion as voluntary contribution and $47 million to a contingency fund for emergencies. In comparison, China contributed $115 million in assessed contributions alone. For the viewers, assessed contributions are mandatory membership fees which are paid by every WHO member. These contributions are calculated using a UN formula based on the country's economic size and ability to pay. On your screens, you can see what the official page of WHO quotes. Assessed contributions are the dues country pay in order to be a member of the World Health Organization. The amount each member state must pay is calculated relative to the country's wealth and population. For the 2022-23 period, the WHO's total approved budget was $10.4 billion, meaning the US accounted for about 12% of the approved budget and China made around 1.5% of the total budget. While this is a huge difference in contribution, China's population is roughly 4.25 times that of the United States. The WHO's most recent two-year budget for 24-25 was $6.8 billion. In 24-25 period, the assessed contribution from the United States is recorded at $216 million, alongside a voluntary contribution of $698 million US, putting its share of WHO's program budget at 14%. And at the same time, China pledged $200 million in 24-25 budget, making their share approximately 3% of the total WHO program budget. However, the financial imbalance was not the only concern for Trump. He also cited the WHO's handling of the COVID-19 pandemic, alleging failures in transparency, independence, and urgent reforms. Listen in to what Trump had to say on that then.
The World Health Organization has become nothing more than a corrupt globalist scam paid for by the United States but owned and controlled by China. When the China virus reached our shores 3 years ago, the World Health Organization disgracefully covered the tracks of the Chinese Communist Party every single step of the way. For this reason, it was my great honor to terminate America's relationship with the World Health Organization. The United States was paying the World Health Organization almost $500 million a year. When I dropped out,
Well, Trump's decision to withdraw was not entirely unexpected. In 2020, during his first term, he had initiated steps to quit the organization while accusing the WHO of aiding China's efforts to mislead the world about the origins of COVID-19. That process was halted when Joe Biden won the 2020 presidential election and reversed the withdrawal on his first day in office. In 2021, in response to the US withdrawal in 2025, the WHO issued a carefully worded statement. It acknowledged the long-standing partnership with the United States, emphasizing that together the two have saved countless lives over the decades. From the eradication of smallpox to bringing polio to the brink of elimination, US institutions have both contributed to and benefited from membership in the WHO. The organization expressed regret over the US and its decision and reiterated its hope that America might reconsider it in the future. WHO officials highlighted that collaboration and constructive dialogue remain vital for protecting the health and well-being of millions globally. This exit now marks the end of nearly 8 decades of US participation in the WHO. The United States has indicated it will instead work directly with other countries and disease surveillance and public health priorities, bypassing the international organization. But the exit itself is not the most shocking news. Washington has not cleared its outstanding dues, which amounted to about $260 million before formally exiting. The $260 million figure comes from the WHO's assessed contribution schedule for 2024, which lists the US at 14% of the organization's mandatory budget, the highest share of any member state. The amount was split evenly across the two-year budget cycle, $130 million for 2024 and $130 million for 2025. While the US exit signals a shift in global health governance, the WHO continues to operate its technical and scientific functions, coordinating with member states and maintaining a neutral stance. But WHO will be affected drastically due to lack of funds. It is forced into deep budget cuts and workforce reductions. The agency is planning to reduce its global workforce by over 2,000 positions, almost a quarter of its staff, through layoffs, retirements and unfilled vacancies, and has even halved its management team while consolidating departments. These measures reflect a broader financial strain that jeopardizes WHO's capacity to respond to health emergencies and maintain core global health programs. In summary, the US withdrawal from the WHO is a historic moment, ending nearly 80 years of participation. It reflects a combination of concerns over financial contributions, perceived bias, pandemic response, and reform delays. While Washington plans to pursue direct bilateral partnership, the broader implications for global health and pandemic preparedness are significant, highlighting the delicate balance between national interests and international collaboration. Padma Shri Dr. Sanjeev Bagai, Chairman of Nephron Clinic, is with us on the program to talk more about this. Dr. Bagai, it's always a pleasure having you. What do you make of this exit? Well, you know, the Americans, of course, have exited, but the fact of the matter is, it's the number one economy in the world, and a contribution of $1 billion roughly a year is not that much for the Americans. Obviously, they were paying this much money because they felt a sense of responsibility as being the strongest nation in the world to do so. Now, Donald Trump has pulled out. What does this mean?
Good evening. I think if you look at the Honorable President of USA at the present moment, the only thing predictable about him is his unpredictability. And the only thing consistent is his inconsistent statements. What can be said? I mean, his views change minute to minute, day to day. And this kind of bullying tactics, what we are seeing in geopolitics, is not arguing well, not only from the economic prosperity of the globe, and neither for the healthcare of the globe. Now, if you look at a global leader should show consistency and responsibility, not self-service. The issue of WHO was that for decades it's not been running appropriately. Why didn't US correct the issue then? It's a full-time member state there in most UN bodies, including WHO. The funding, of course, US is giving the maximum, but if there was a discrepancy, it could have been sorted out internally. WHO could have been more result-oriented. Yes, of course, it faltered not once, but on 9 or 10 different occasions, including it not recognizing that COVID-19 SARS-CoV-2 was airborne. And during that period of 4 to 8 weeks, it spread all over the world. But having said that, its response in COVID was poor, to say the least. Why didn't US correct it then? US also didn't share its vaccines with the rest of the globe. It was a famous 80-20 ratio. 80% of the vaccines which are produced globally went to 20% of the countries of the West. India was one amongst the only countries which gave vaccines free of cost to more than 54 different countries. The US withdrawing and not clearing its debt is going to have a huge impact. Apart from it being it's the largest contributor, it has good scientists, good researchers. Pandemic response worldwide will be affected. Vaccine research will be affected. R&D of drugs will be affected. Overall, the lost abandoned child of the world, Africa, was the worst hit during COVID. No one is talking about it. How is healthcare in the third world countries going to improve? Yes, we need a new avatar of WHO. With or without US, it doesn't matter. But we need WHO to be more effective. But more importantly, we need US to be more consistent in its views and look at world as one. US cannot survive alone. You want Venezuela on one day, you want Canada on another, you want Greenland on the third, and walk out of WHO. That's not global leadership.
You're quite right about that, sir. Always a pleasure having you. Thank you so much for
Thank you.
putting perspective into this matter. We take a break. We'll be back.